Ciao Nito, my name is Caitlin Schwagel and I am a student from Columbia University School of Nursing in New York City.
Hello Regina Margarita, my name is James Christopher, and to answer some of your questions you've put forth.
Ciao tutti!
Hi everyone, my name is Alex. I am a Doctor of Nursing Practice candidate here at Columbia University with an adult gerontology primary care specialty. I also work as a registered nurse in outpatient oncology, and I participated in the exchange program back in 2018 as a student in Turin.
I traveled to Turin, Italy and worked at the hospital Regina Margarita for 6 weeks in April and May 2019. While I was in Turin, I worked on the pediatric cardiac intensive care unit for 6 weeks there, and I really enjoyed my time and all of the people that I got to meet through this program.
Yeah, so it was the first time I ever saw like a lumbar puncture, any dressing changes, or even diagnostic testings like ultrasounds. That was all new to me. However, when it comes to comparison with the States, they're all pretty similar testing, but that was actually the first time I saw those types of tests were in the hospital in Torino. So it was just a great overall experience for me and set a foundation for me to do my work currently at Memorial Sloan Kettering in New York City's Cancer Center in oncology.
When I was in Italy doing my part of the program, which I thoroughly enjoyed, I learned how to draw labs from an A-line. I measured and drained intracranial pressure using a ventricular drain. I administered IV push medications and IV drip medications. I prepared and administered TPN. I performed suctioning of endotracheal tubes, and I collected blood for measuring blood gases.
I'll first answer and speak to the first question about some of the strengths of the Italian NHS when compared to the US healthcare system. And what comes to mind really as the biggest strength in my mind is this concept of continuity of care and universalism, which is something that we really don't have in the United States across the board, and something that we are still working towards, that I think is really beneficial to our patients and the care that they receive. Especially in gerontology as a primary care nurse practitioner, I think that the concept that the Italian NHS has involves low cost or no cost to the patient in terms of general practitioner care. And when we think of all the services that go into that, including laboratory work, if needed, ambulance services, and especially prescription medications, I think that that is a major strength of the Italian NHS. This low cost or, again, no fee associated coverage of medications prescribed by a general practitioner. That is not often something that we see across the board in the United States. Often medications come with a very high cost or a very high copay, and it leaves many people with a large fee to pay if that is the regimen that has been shown to be most efficacious for their disease process, and it really leaves people in a difficult position. So I think that this continuity, this universalism is a major strength of the Italian healthcare system.
Before I got to Italy, I knew very little Italian. I read some books and studied a little bit before I got there to have a basic understanding, but I did not understand much. The students and Lily that we worked with at the university were so kind and so nice, and really helped with the translations and making sure that I felt comfortable and welcomed in the program. For the most part, I was always able to get across what I wanted to say. The students, their understanding of English helped so much because I really didn't know much Italian. And if there was ever a time that we weren't able to communicate, we were able to use Google Translate or phone apps to talk and figure out what we were trying to say. So for the most part, I really didn't have a problem with that at all.
I felt very prepared going into Torino to work in the hospital. I thought Lisa and the staff at Columbia did a great job of painting a picture of what our first 6 weeks would be like over there. And then when we got there, our resources with Lily and the rest of the hospital staff and our preceptors were tremendous. So if you had any questions or even had any hesitations with what we were working on, we got clarification through all the resources that were provided for us both in the States and abroad in Torino at the hospital. So couldn't have asked for a better way to go into a situation.
In the US, I was taught very different methods for performing these skills. And from very different nurses, there are lots of different ways to do things. Whereas in Italy, I had one nurse and one method of performing each skill, which I think was a lot easier to follow and learn because it was the same every time. But for drawing labs from the A-line, for example, I learned in Italy to use an alcohol wipe for the port after you open the cap and just before closing it back up. In the US, I didn't see nurses doing this every single time. And at the same time, in the US, many different nurses use different types of caps for the A-line. They would use the little green cap with chlorhexidine in it, or they wouldn't keep a cap at all. But in Italy, we used red caps every single time. When collecting the waste blood for an A-line, in Italy, I learned that you use the 6 ml syringe to collect the waste, and then you put it back after you've collected your sample. And in the US, I was told to put a vacutainer on the A-line, collect your waste blood from using a pink tube, and then you just remove the pink tube. You don't put the blood back into the A-line. There's other examples of things that were different in the US. I haven't had the opportunity to use a syringe pump, but I'm also working on adults, whereas in Italy I was working with pediatric patients. And along with the A-line thing, in the US, I haven't seen many nurses use the flush that is connected to the A-line. A lot of them use a prepackaged saline flush that comes from it's like wrapped up in plastic, and you don't make it yourself. You just get it from the package. In Italy, we would make our own saline flushes from the community bottle and use that to flush medications. And then for the A-line, we would use the fluids that were connected to the A-line for flushing. Something else. As far as TPN, in the US, I've only seen TPN made in the pharmacy and then delivered to the nurse once she requested it and verified the patient information. Whereas in Italy, we created the TPN ourselves using the constituents that we found and would make it ourselves at the bedside. So that's different. And for suctioning, in the US, I've only used inline suctioning, which is when the actual tube for suctioning is connected to the patient and stays connected to them, and it doesn't require any sterile gloves. And then in Italy, we would use sterile gloves and take the tube out of a package and keep the procedure sterile as we were suctioning them. So those are some of the differences that I experienced between Italy and the US.
Speaking to my experience in Turin, I would 100% participate again if given the opportunity, but I would also encourage any student who's considering participating to absolutely go ahead and do it. It was one of the most wonderful experiences, personally and professionally. When I traveled and worked at Regina Margherita, I was not even a licensed nurse here in the United States. We were still finishing our coursework, and working in the pediatric cardiac ICU gave me a very unique experience because my license here will be caring for adults. So this is an area of expertise that I was able to participate in and observe and learn, which is very different from what my practice will look like here and what it does look like as a registered nurse here. And I made some great friendships. I learned a lot about not only comparing the healthcare system, but really delving in and learning and being open to the differences, the similarities, what the day-to-day life and workflow looks like for a registered nurse, all of which are so crucial when developing your own practice. My participation in this exchange was without a doubt the highlight of my time here at Columbia, and I could not recommend it more, and I hope to find myself back in Turin very soon. Bye.